Pernicious anemia. What is pernicious anemia? Pernicious anemia is a type of macrocytic, megaloblastic anemia. It is caused by a deficiency of vitamin B12, which is essential for the proper production of red blood cells. The deficiency arises from the body's inability to absorb vitamin B12. Often due to a lack of intrinsic factor, a protein necessary for B12 absorption. What is the type of anemia in pernicious anemia? It is a type of macrocytic, megaloblastic anemia. Macrocytic means that, in pernicious anemia, the red blood cells are larger than normal. It is called megaloblastic anemia because, in this type of anemia, the bone marrow contains large, immature red blood cell precursors called megaloblasts. What do we see in the peripheral blood smear of pernicious anemia? A peripheral blood smear in megaloblastic anemia typically shows macro-ovalocytes. These are large, oval-shaped red blood cells. Anisocytosis, variation in cell size. Picolocytosis, variation in cell shape. And hypersegmented neutrophils with 6 or more lobes. These findings, along with macrocytic indices, MCV more than 100 femtoliters, and reticulocytopenia, low reticulocyte count, strongly suggest megaloblastic anemia. What is the cause of pernicious anemia? Pernicious anemia is often linked to autoimmune gastritis, where the body's immune system attacks and destroys parietal cells, thus reducing intrinsic factor production. In pernicious anemia, the immune system produces antibodies that target and damage gastric parietal cells. These parietal cells are crucial for producing intrinsic factor, a protein needed for vitamin B12 absorption in the small intestine. When parietal cells are damaged, less intrinsic factor is produced, hindering vitamin B12 absorption. Relation between gastrectomy and pernicious anemia. Pernicious anemia can be caused by gastrectomy, specifically due to the removal of the stomach or parts of it, which is where intrinsic factor is produced. When a significant portion or all of the stomach is removed, the body may not be able to produce enough intrinsic factor, leading to malabsorption of vitamin B12. This malabsorption results in vitamin B12 deficiency, which can progress to pernicious anemia, a type of megaloblastic anemia. Therefore, patients who have undergone gastrectomy, especially total gastrectomy, are at increased risk of developing pernicious anemia due to impaired vitamin B12 absorption. What are the signs of pernicious anemia in patients? Pernicious anemia is characterized by a deficiency of vitamin B12 due to the body's inability to absorb it, leading to a range of symptoms. Common features include signs due to anemia. This includes fatigue, weakness, shortness of breath, and pale skin. Signs due to autoimmune gastritis. Gastrointestinal issues include diarrhea or constipation. Neurological symptoms due to decreased B12 for nerves. This includes symptoms such as numbness, tingling, and weakness in the extremities, peripheral neuropathy. In severe cases, it can cause cognitive problems, including memory loss, confusion, and even depression.